Hello, everyone, and welcome to Global Outlook. I'm Mary Sitt. Houston Community College has one of the largest student populations in the nation, and that means students must navigate a somewhat complicated process of rules and regulations when English is not their first language. Well, our first guest is often the first face students see and the first email they receive, and she quickly becomes a welcomed guide for them. Arnaude Lewath is Executive Administrative Assistant at the Office of International Student Services and Study Abroad. Thanks so much for being with us. You help prospective international students come to HCC. How complicated the process is that for them?
The process can be complicated for them based on the language, understanding the language and the system. But in fact, the process indeed is not complicated based on how it has been designed. It's very detailed online. However, we always need to take time to explain to students because we are aware of the differences in the culture and also differences in the education system.
So how many steps do prospective students go through to get to HCC? Can you sort of detail each step?
Yes, we have about 5 steps. The main steps are 5. First, the student has to submit the online application. And secondly, the student has to activate the student account by signing into the Eagle system. Thirdly, the student has to upload the supporting document under the checklist. Thirdly, the student has to prepare the documents, and we have a list of documents on our website. And fourthly, the student has to upload the supporting document. The 5th step is for the students to expect the I-20 from our office and apply for student visa.
Now, Arnaude, you mentioned earlier that sometimes students just assume that the process is going to be similar to their country's process, but it's really not. So you mentioned that you really have to take the time to explain it. Can you talk about that process?
Usually when students come to HCC and they believe that the process should be the same as the process they go through in their home country. But it's not always the same. There might be similarities, but it's not always the same. So when students want to apply, we first have to direct them on understanding the process, the application process, which is completely done online. For some students, they think they can send us paper application, but all the process is done online. And we have to work with them from step 1, from the personal information, providing the personal information, to completing their educational background.
So does this take a couple of months to do, or can they sort of like speed track it through, or depends on the student?
The process is about 15 minutes to complete all of that. Is 15 minutes because everything is already loaded on the system. The student only has to read and follow step by step. And for every step of application, when our office thought that it might be difficult for students to understand, there is always a description. But as I mentioned earlier, students usually have this language barrier and the understanding of what is written. So sometimes we have to read what is written and explain to them word by word what it means so that they can understand. And we are totally aware that they are not used to that. So we have to do that to help them understand what is expected from them.
So do you have translators? I know you speak French, you're fluent in French, but other than French speaking students, how do you handle the other languages?
The first challenge is language barrier. I speak French. And we also have other colleagues in our office. We have other people speaking like Vietnamese, Chinese, Spanish. So we have a variety of languages available, of people speaking other languages to help and assist the student.
Once the student gets here, it's important to maintain their F1 status to be here legally. What are the things they have to do to maintain that status?
To maintain their F1 status, first of all, when they get here, they have to check in with our school. So when they check in with our office, then they have to complete the pre-enrollment process, which is taking the placement test and enrolling in class. Then enrolling full-time, that's the first step to maintaining
enroll full-time.
Enrolling full-time, and it's 12 credit hours for full-time enrollment, international. So they have to enroll full-time, and they have to pass their classes.
They have to make a grade C or better, or D or better, as long as it's not an F, right? They have to pass.
Yes, as long as it's not an F, they have to pass the classes.
And do some of the students come here on F1 and immediately start English classes, to improve their English, and then go into the other courses, or do they do it simultaneously?
When students come during the pre-enrollment process, they have to take the placement test, and we have Acuplacer ESL that help determine their English level. If they meet the requirements of English language, they are guided to take TSI, and this is done with academic advisors. So they take the TSI, but when they don't meet the English language requirements, they are placed into English classes. They cannot, if they don't meet the English language requirements, they cannot go take academic classes. They have to complete the English classes first before taking the academic classes.
And they can keep that F1 status while they're taking those English classes. Okay.
Provided they are enrolled full-time.
Okay. Tell me, what do you enjoy most about working with international students?
What I enjoy most is helping them, sharing my HCC experience with them, because I have been an HCC student myself. So that helps me to share with them and to guide them, because I am aware that there are things that if you have not experienced as a student, you will not be able to explain to another student. That's what makes my joy working with them, like helping them not to make the same mistakes that I've made while being.
And you draw from your own experience to help them. Where are you from originally, and how did you come to HCC?
I am from Cameroon, and I came to HCC thanks to, I would give credit to Kristalina Carson, because she discovered me when I was doubting myself, and she really encouraged me to complete the application process first as a work study, and with the support of other colleagues, I've been able to go through the hiring process.
That's terrific. And what do you tell other international students when they feel discouraged over here, or a little scared or homesick?
What I would tell them is to keep pushing, not to be discouraged, to pay attention to what we tell them, because we're here to help them. To pay attention to what we say, we're here to help them, and not to be discouraged, to ask any questions they have. Not to think that there are questions not to be asked. We are here to answer all the questions that they might have. And
you're very friendly. I'm sure you're not intimidating, and students warm up to you and talk to you and ask for help. So that's so nice. Thank you so much for being with us and explaining what you do at the Office of International Student Services. Appreciate it.
Thank you for having me.
Coming up next, nearly 65 million Americans report an episode of back pain. Our next guest will tell us that breathing, teeth, and posture can help. We'll explain when we come back.
Being prepared is a part of who you are, but it's especially important in the case of a disaster. Be informed about possible emergencies in your area. Make a plan that covers where you'll go in an emergency. Build a kit with the things you need to survive. There's no one more capable of planning for your situation than you. Start your plan today. Go to ready.gov/myplan.
I want to eat apples and bananas. I need to eat apples and bananas. Why can't I eat apples and bananas?
Support the Feeding America nationwide network of food banks to help provide meals to those in need. Join us at feedingamerica.org.
I don't remember how it started.
Go to that.
Our back and forth. it always came back.
Dad!
You probably don't remember what you told me,
That was perfect.
but I heard every word.
The faculty at HCC represents the best of the city. They're committed to getting our students to their goals. HCC, for everyone, anytime, anyway.
Back pain is the sixth most costly medical condition in the United States. Some 16 million adults, that's 8% of all adults, complain about chronic back pain. Well, our next guest has a solution to that. Dr. Alice Lam is a dentist who practices comprehensive and whole health dentistry, and she's been trained in a technique called postural restoration therapy that can help alleviate back pain. Dr. Lam, thanks for being with us.
Thank you for having me.
So what exactly is postural restoration therapy? It's a mouthful.
Yeah, it is. I started out doing dentistry, doing a lot of cosmetic work. And a lot of people who come in that have broken down teeth also have other issues that they sometimes don't share with their dentist. They just think they're there to look good. And a lot of them are mostly headaches, head and neck pain. And, sometimes you attribute it to sitting at the computer or your job, but oftentimes there's underlying situations that you may not even know about. And so in me recreating beautiful smiles, I started fixing headaches. And my journey kind of started there. And once we started working with people's headaches, and some people, 90% of people will do really great with, a new bite, getting their teeth aligned, and then not having the headache. But then there's a number of people that years later, after everything's fine, it comes back. And when you're talking years later, I'm talking just maybe 2 years later to as much as 10 years later, and they attribute, well, I'm getting old and all that. So, after 20 years of seeing this over and over again, I started searching outside of our profession to see what else is more, because there's got to be more, because as dentists, we just treat the head and neck, but we really do not give enough honor to the rest of the body, because, patients don't walk in my door with just a head and neck. They got a body that came with it. And so I started work from my own issues. I had TMJ and headache issues, and then it translated down to my feet. I love to wear heels. I couldn't wear heels anymore. It just started hurting. And so I found, just through my the circle of pain management, I found postural restoration, which has been pretty much a game changer in how I practice dentistry.
So does that mean that posture restoration, we have to restore the way we're supposed to be standing, sitting, moving?
Yeah, but it's all connected.
Things?
Yeah, it's all connected. Your teeth can actually shift and change.
Mm-hmm.
And in the shifting and changing, actually change your entire body posture and how you walk and how you run and how you perform, daily activities.
Wait a minute. Wait. Our teeth and the way our teeth shifts can change the way we walk?
Yes.
Okay.
And the way we walk can change the way our teeth look. That's why people said, well, I started out, I really like my smile, but now all these things are changing. And then they go into orthodontics and get braces, and then they end up needing retainers for the rest of their life. The reason they need retainers for the rest of their life and the reason their teeth move is because there's other forces in your body that's demanding that movement. And now you're locking it with retainers. And in locking with retainers, you'll have a beautiful smile. But if you are a high functioning athlete, you can actually blow out a knee, a hip. You're going to find that you're not going to have that maximum performance of your body, because our bodies. And I'll give you an idea what I mean by that. Okay. First of all, teeth are not just there for you to chew. They're actually they're sensory organs. I don't know if you know that.
They're sensory organs? Okay.
They're sensory organs. And you can test this out. Just think about the last time you ate a bag of M&Ms. How does your teeth know how to crush through the hard part and slow down the soft part so that you don't crash? and you
Right.
got a mouthful of it. And imagine adding peanuts to that, or a salad, that's soft and you got to shear things. It's a sensory organ. And that sensory organ is tremendous because every time you swallow, the tops of your teeth come together. Okay. And we swallow about 2,000 times a day.
Wow.
Okay. And so if the tops of your teeth come together, it's a sensory organ that tells you where you're at in space.
Okay.
And so it positions your head for airway. The way your teeth are positioned can actually cause you to have something called sleep apnea at night.
Mhm.
Or just difficulty breathing, where you don't realize that you have difficulty breathing because your body will compensate. You move your head one way, your neck another. Most people move their neck forward in order to open up their own airway. And the way your teeth come together tells your brain, tells your head how to position so you can have best air. So airway are two body function that trumps everything, and that we hurt ourselves over everything, is airway and the ability to stay upright.
Okay.
You have to breathe and you have to be able to stay upright, see the horizontal, and walk.
Right.
So the
Right.
teeth are an organ that actually will dictate that. Every time you swallow, that's why we swallow 2,000 times a day, because it tells you where you're at in space, so the brain knows how to breathe and how to stay upright.
So are you
Now-
saying that the first thing we have to do is like correct our teeth and make sure it's aligned right, and then everything else sort of falls into place? Or do we correct posture or breathing and then everything else aligns?
You know what? Yes, and yes.
Okay, so it's all integrated.
Sometimes it's this dog that wags the tail on the bottom, and sometimes it's the dog down here that wags the tail up here. It just
Okay.
depends on what your situation is. And, a majority of us are asymmetrical in our body because we have, liver on one side, lungs on the other, here's a heart. I mean, we don't have symmetrical organs. And so our body, about probably 98% of people's bodies will always shift to the right. We are always have the tendency to shift our entire gait to the right.
So we're dominant on the
We're
right side.
dominant on that right side.
Like we're
which is
right-handed,
fine.
so we're dominant. Uh-huh.
Yeah. We're dominant on the right side, but sometimes as we get older, we dive deeper into patterns that take us to that right side. And some people who are high functioning athletes, or you do certain work that demands you to do certain things and you use your right side more, you almost can't move back to your left. And so you start cornering yourself into patterns that takes you to your right side. And that's the reason why, I'll show you some pictures, people's faces. They're like, how come my face doesn't look the same on pictures anymore? I feel like my eyes are not leveled anymore. My ears are not. Is because of that asymmetry and the patterns that we create over the years.
So then do
And
we have to
so-
learn exercises to counter that?
That's what postural restoration is. What we do is we look at the entire body. I work with two phenomenal postural restoration therapists, Mike Cantrell and James Guzman. Mike is probably one of the top 3 in the world as far as, he has been doing this for over 20 years. He's one of the developers of a lot of the understanding that we have today. And I actually flew to see him. That's how I found him. And now he flies to Houston a couple of times a month to help me with patients that we want to get aligned.
And he's basically a physical therapist that works with you.
Well,
Or more than that.
a physical therapist by basic training. And then he went on and did postural restoration, which is like a whole new subspecialty.
Okay.
So from a school standpoint, you can get there through physical therapy. You can get there through massage therapy. You can get there by doing performance specialty, and athletic training and coaching. So all those types are the people that we want. And this area is booming because we need therapists and we need dentists that will join forces to help people align their whole body. This is truly just what I call basic physical medicine, which is a lost art. We now go to pills and surgery or cosmetic dentistry to make ourselves look good as we get older, but we don't realize the asymmetry that we're creating has to do with our body alignment. So when we get to the root of the problem, we can actually correct somebody in a natural way, and they end up feeling good. I mean, it changes everything, even your digestion, because when your body posture changes, position of your stomach changes, and you can have good gastric emptying. It goes beyond. That's why the new
Well,
center.
Dr. Lam, this sounds fascinating, but it also sounds a little weird because we've never been taught this before. I've never heard of this before. It's like, what? Are you kidding? Your teeth and your back, it's all related. So we need to take a little break now, but we'll be right back with more from you to explain about postural restoration therapy.
Meet the scan, a simple procedure whose mission is to detect lung cancer early.
I'm here to save you.
But I feel fine.
That's great, but you may still be at high risk for lung cancer.
Oh man, that's a new fence.
If you smoke, early detection could save your life. Learn more at savedbythescan.org.
Today I'm going to talk to you about physics. Come on in, girls. Let's go. This is the first rocket to get humans to Mars.
Really tall.
I'm a rocket structural engineer, designing and building parts of the rocket. You are the generation that will be stepping foot on Mars. Do I have a group of astronauts on my hands?
Yes.
You can become a rocket scientist or whatever else you want to be.
When I was in foster care, I never knew when I would have to move. So I always had my suitcase ready to go. Then one day I was adopted. My new parents opened their hearts and home to me. My parents cook my favorite breakfast for me every morning. My parents take me on trips I never thought I would go on. They gave me a home and an even better reason to use that suitcase. My parents aren't perfect, but they're perfect for me.
I love teaching at HCC. I love helping students.
With college credits.
With scholarships and financial aid.
Training them for life-changing careers.
Come learn with us. HCC, for everyone, anytime, anyway.
We've been talking to Dr. Alice Lam, who studied at the UT Health Science Center, San Antonio Dental School, and the prestigious Pankey Institute, where she learned about a holistic approach to dentistry. Dr. Lam's here to talk to us about something called postural restoration therapy and how our teeth, our posture, and our breathing can all affect our health. So Dr. Lam, how do you teach the body to get into proper alignment?
Well, you know, a lot of us have this misconception that sitting straight up with an arched back is good posture. But actually that's the worst posture, because when you're in that position, your lower back muscle has to work to get you there. And then you can't breathe very well because now you're only breathing with your upper chest. Okay. So one of it is you have to tuck your ribs in, and it's, you know, I always say breathing is so important. And most people think breathing is taking these deep, deep inhalations. So in order to do that, especially if their body is out of alignment, they extend. That means they arch their back. They try to get their shoulders back because they think they can breathe deeper. Well, the more you do that, the less ability you have to breathe. So if you tuck your lower ribs in, it's about the exhale. Mm-hmm. So one of the things that we do with almost every patient is work on exhale, not inhale. Okay. So when you breathe in, you try to breathe in with your upper chest, not your belly. People keep saying, oh, belly breathing is good, but it's only the right belly breathing. And I think there's such a misconception about breathing.
Okay, so can you demonstrate the right way to breathe in and breathe out?
I could. So when you breathe in, you have to tuck your ribs in. Okay. And because we're right dominant, we try to go more to the left, so you tuck your left rib in. Okay. And you want to feel your obliques, which is the side muscle. And the way you can feel your oblique, if you cough, you find it. You find that oblique. Okay. And it should be on. And then when you breathe, you just breathe in with your upper chest, but without doing this. Okay. Stay tucked in. And then it's about the exhale. The exhale is so much more important than the inhale. If you can exhale and hold and just let the exhale go up to 10 seconds, and then you inhale, you'll be in much better shape. It's about the exhale. You got to get rid of the carbon dioxide. A majority of us in good posture all the way up, we're breathing shallow breaths.
Right.
Do you see? So it's about the exhale. Once you get a good exhale and your body straightens rather than extended, then you'll get a better inhalation. And that will really help the back.
So when you exhale slowly and sort of count so you get those 10 seconds.
You get the 10. If you can, and some people, they're like, oh, I can do 10 seconds, but you don't want to exhale and then, you want to be able to exhale. And then when you inhale, it's a light inhale. You're not looking for deep inhale. It's about the exhale. We always say, Mike and I would tease, we said, we're all Whitney Houston waiting to exhale. We need to exhale. Get rid of, all the toxins and all that. Is the exhale that's more important because it sets you up for a good inhale.
So what happens, Dr. Lam, when we start learning to breathe the correct way? What will we start noticing?
You'll start noticing natural relaxation without having to stretch. We all keep feeling like we're stretching. The reason we do is because we're so tense from the wrong type of breathing, which can actually come from your teeth. Sometimes you can't even do this without appliance therapy, which is what I do. Part of what I do is make different types of appliances to reposition the tongue, because if the tongue's in the wrong position, what I'm asking you to do, you won't be able to do properly. So that's where dentistry comes in with the body. I work with the head and neck to reposition the alignment in order to get the neck to a position where you can even inhale properly, where you can even take in air properly. It's now in my practice, the way that we do dentistry is when we do a comprehensive exam, we look at the entire body, from your nostrils to your tongue position, to your breathing, to your swallowing, all the way down. We look at your rib cage, we look at your hips. We look at all the way down, because so many people suffer unnecessary pain just because all the disciplines are so fragmented. Nobody's coming together to do this thing.
Dr. Lam, can this therapy actually help all kinds of back pain, or just certain things it can only do?
It can help back pain. It can help your knee pain. It can help your ankle pain. Foot pain is how I got started. I had such bad foot pain that I couldn't wear proper shoes. I couldn't find good shoes.
Right.
So it's the whole body. It's so important to just look at the whole body, how we're aligned, how we breathe. And those simple things can actually change your life. And I have patients that we're told they have herniated disc and need surgery. And we work with their body alignment. And when they come back, they don't have pain anymore. So the surgeon said, well, if you don't have pain and you're managing, we don't need to do surgery.
Wow.
So
is it difficult to learn that proper alignment and learn those exercises?
I don't think it's a difficulty in learning. It's a shift in mindset. Okay. We're used to a certain mindset of good posture, stand straight back, this and that. So you have to, once you understand the basic concept, which we spend a lot of time with our patients doing, then you get it. And then you start learning how to sit properly in a car, in front of a computer, and all of that. Yeah.
Dr. Lam, thank you so much for being with us. This is fascinating. We'll find out more from your website about how this all works. Thank you so much.
Yes, thank you so much for having me.
That's all for this edition of Global Outlook. We'll see you again every Friday and Sunday at 7:30 a.m. and p.m. plus Saturday at 10 a.m. You can also go to our website, hccs.edu/podcast, and download a podcast to go, or see the full video version on HCC's YouTube channel. I'm Mary Sitt. Thanks for joining us.